Hi, welcome to this module. Now until last module what we are relying on? We are relying on the cell morphology, and based on the cell morphology can we understand whether the person is suffering from cancer or not. We cannot still confirm until we go for the tissue morphology, that is screening of patient can be done based on the cells, but to identify whether a person is suffering or not, we have to rely on gold standard, which is the biopsy, and in biopsy you have to take out the tissue and do the gold standard, which is biomarker testing and imaging. Now here in today's module I want to discuss on the a device that you can develop to take the images from the oral cavity and send it to a remote specialist, a remote clinician. So, there are several devices existing in the market, and if we have a chance I will just get the videos of those devices, so that you understand how it is used in real life application, and we will talk about one such device that we can develop with our pre-existing knowledge of electronics and systems. Okay. So, when you talk about again oral cancer diagnosis, we are talking about oral cancer because we want to take images in the oral cavity. So, a system that can go within the mouth and can reach the hard to access area that a mobile cannot use. So, if I use my mobile and if I take the images, right, you cannot see the image of my of some of the regions in my mouth, right. If you see here and you see that only some of the areas you can access, right. You can pull out the lips and you can see only some of the areas here, or so the what I am showing you here is that I cannot go like if I have a pen. If I have a pen I can go further within it, no. So, you can use this pen or such a device instead of mobile. Right now what happens, the semi skilled person like ASHA workers, they are given mobile to take the images and send to a remote oncopathologist or remote experts, clinicians, but can you rely on mobile? You cannot, because it cannot get the images in some of the area within the mouth, right. This is the problem, and that is why we have to come up with a solution of how can we access those areas, and that is the topic of today's module. So, this is visual examination, or you can say light based detection system. So, can I develop a device like a pen with my electronic system integrated on it, and I can access, I can send the pen within it. It has a onboard display, so that ASHA worker can see, right, and it can store the images, it can do the AI and lot of other stuff. So, if you see the screen, we are talking about diagnosing the oral cancer and visual examination, which is custom built diagnostic device. There can be excision biopsy and histopathology, right, that we know. Oral brush biopsy we have seen, there can be a toluidine blue, there is another method of doing it, light based detection system, chemiluminescence, tissue fluorescence imaging, which is a Wellscope, tissue fluorescence spectroscopy, there are biomarkers, there are DNA analysis, there are laser capture micro dissection. So, lot of existing systems are there, and what we have focused right now is on image analysis technique, which is your biopsy and histopathology. In particular, we are talking about the oral brush biopsy, where we are talking about the cytopathology. All right. So, if I want to see the system, can I develop such kind of system where we can place the system within the mouth and can reach to region which are hard to access by a mobile camera. So, you can develop this thing. If you take the idea from a mouth mirror, then you can understand that this angle of 70 degree, if you go to a dentist, if you have seen, there is a mouth mirror in which the dentist is able to see the cavity and its different regions within the mouth, right. So, same thing we can use it for getting the images. There is a camera and 70 degree anterior portion, we have a Raspberry Pi to look at the images in real time. We have a charging port that you can recharge the system, right, and if you see here, if I see the blown up diagram, then what is there? There is a Raspberry Pi using injection molding, we can use this one. We have lithium ion battery, you have camera, you have charging module, boost converter, and you have Raspberry Pi Zero to store the images as well. So, if I talk about further, then the capture images of hard and soft tissues inside oral cavity is possible. With this, a camera with light source illuminates the region of interest, that is 70-degree anterior angle. There is an on-board processing unit and display unit, and that is the advantage of this particular system over the existing systems. We will also see what are the existing systems, and we will try to find out some of the videos for you, so that you will understand how it is done in the real life situation. Then we have a support to store the capture images. What you will do once you capture the images? You have to store the images. The storing of the images is possible with this kind of tool. Of course, the cost is a very important issue, and that is why the tool is costing way lower than the existing devices. It can be used by semi-skilled person such as accredited social health activists, which I call ASHA workers, right. So, these are the advantages of developing such kind of tool over existing devices, and that is why this can be used as an electronic system for screening the oral cancer patients. If you see further, once you put in the mouth, there should be a sleeve that you can just throw it out, and you can again sleeve the next for the next patient. So, there is a removable sleeve. There is an electronic system with an intraoral camera with 4 bright LEDs in the front, and like I said, there is a live video stream possible. We are trying to get a wireless capability to the system, and so that it is easy to use for a remote pathologist, or also not for the remote pathologist, for the ASHA worker also. This can be also used in a dentistry, where you have to take you have to look at the images. You can look at the images on the this LCD display as well. So, these are the specification of parameters versus value, certain parameters like what are the camera, or what is the camera that we have used, what is the microprocessor that we have used, what kind of display we are using, is the battery chargeable, dischargeable, what is the charging time, what is the discharging time, what is the power, what is the weight of the complete system. So, these are some of the parameters, you can look into that. Now, further you can see here, this is how we have packed the devices. You have a lithium ion charger battery, which is right over shown here. You have a boost converter, you have micro USB charging port, you have on off switch, you have Raspberry Pi Zero, and the bright LEDs along with the 2 megapixel camera, but we can also use a autofocus night vision camera, so that we can get a better images. So, these are some of the images that we had taken from labial mucosa, from dorsal surface of tongue. I was showing it to you. I was showing you the mandibular. I was showing it to you the right buccal mucosa with tobacco stain. Now, this particular thing is in. So, I was not showing it to you this particular stain. It's my bad. Actually, I was showing it to you the mandibular, which is your labial mucosa. I was showing you this one, and dorsal surface of tongue. This is when a patient is having a habit of eating tobacco or chewing tobacco. In that case, the right buccal mucosa with tobacco stain we can see right over here, and the palate is also visible. But the disadvantage of the mobile I have already discussed, and that is why this system can be used to take images from several regions, right. So, in my case, when you see this particular region, you will see it is clear, because I do not endorse, rather I do not use a tobacco for chewing, and in fact I will advise you guys not to use any tobacco or tobacco related products, because it is really harmful. Even chewing the betel nuts are really harmful. So, as if you want to be healthy, stay away from tobacco related items, pan, masala, the cigarettes, something in the villages you will also find bidi, right. So, please stay away from all this kind of nuisance. It is going to hamper your health, and if you are talking about healthcare technologies, first thing is we should understand that what are the things, how can we have a better precaution, how can we have a healthier life, and healthier life is when you are away from tobacco, right. So, try to be away from tobacco, try to be away from any related products, including smoking of tobacco like cigarettes. It is harmful for your lungs, it will cause lot of damages to your mouth. There is a oral cancer chances are very high for people who smoke tobacco, chew tobacco, and also chew tobacco related products. So, my sincere advice and sincere appeal to all you guys who are watching this particular program is to stay away from such kind of habits, and have a healthy lifestyle where you can eat pan, but without tobacco. You see, that is good for health, by the way, but when we add the tobacco related products, it is not good. Betel nuts to much extent not good, right. So, anyway, my point is that if you see the buccal mucosa in my mouth, you will see that it is different than the one that you can see right over here. So, that is the difference that we can obtain if we have the image. So, imaging is very important, and to develop a system for capturing this image is also equally important. We are talking about a system that can be used to obtain the images or capture the images. Once you capture the images, the system should be able to store the images. The system should not only be able to store the images, but able to transmit the image wirelessly, because if I take the image in my mobile, I can send the images wirelessly. So, my system should also be able to store and so capture, store and transmit the images using wireless. Also, let us see what are the existing systems that are used for this kind of application. Now, if you see, there are certain systems. First is Wellscope, then we have a Oral ID, we have a OSCAN, and then we are talking about our system. Okay. So, let us see when we talk about electronics. So, electronics, the Wellscope and Oral ID as well as the OSCAN, they all have only LEDs and optics and does not have inbuilt processor, while in our case we have a inbuilt processor, right. Usages, this can be used, Wellscope can be used as a standalone examination tool or as an attachment to the mobile. Oral ID can be used as a standalone examination tool, neither interface with mobile nor can be attached to mobile. While we talk about OSCAN or OSCAN, then can be used by attaching to the mobile. While in our case can be used as standalone examination tool. It also comes with an Android app and tool is interface already with it. So, what does that mean? If you see this particular device, this system, if you see the image, the system already has the inbuilt capability of storing the images. Also, we can have the app right integrated onto this particular platform. So, that is the advantage. Now, another thing are display. So, viewed directly with naked eye, viewed directly with naked eye in case of Wellscope and Oral ID. Also, in case of OSCAN, it is viewed directly with naked eye, but can be viewed on a big LCD or LED display. That is the advantage. Wireless communication, it is not there in all three, while in our case we have the wireless communication, Android mobile using Wi-Fi and can be send images to it. Fluorescence based diagnosis, it is available in all three, while we have both white light and fluorescence based diagnosis. That is the advantage. Next one is cloud connectivity in all three. When we are talking about the remote server, we require a cloud server. In case of Wellscope, in case of the Oral ID, or we in case of the OSCAN, we have the we do not have the cloud connectivity, while in our case we have that. Finally, the camera that is used is phone's camera. Here there is no camera, here use phone's camera, while we are using a 1/9 inch display CMOS camera module with integrated 12 LEDs. for illuminating mouth. Camera has inbuilt autofocus features, so we can capture 2 images at different distance for processing. That is advantage over existing module. When you talk about operating system, none of this operating system, and we are using Linux operating system. Data storage in local device and cloud, it is not available in any of them, but we can do that. Potential to create detailed oral profile of several patients, we can do that, and there is a potential of adding artificial intelligence, we can also do that, right. Now as far as our literature survey goes, there is about 300,000 which is 3 lakh rupees, 1 lakh rupee. We do not have any value for this, so we are assuming that it is not in market, where our cost estimation is only 30,000, right. So there is an advantage over the Wellscope, Oral ID and OSCAN. When I am talking about Wellscope, it is about 3 lakh, Oral ID is about 1 lakh. We do not have the value for this, but for our system it is about 30,000 rupees. That is what I talked. I think you cannot see, but if you can see, then this is what I meant. Okay. So, comparison of various oral assessment devices is right over here. This is how the Wellscope system is used. As you can see, we had to rely on the eye sight of a clinician, and he has to see through the Wellscope. It is a fluorescence imaging, you can see, to understand whether a person is suffering from cancer or not. Oral ID, as you can see here, right, can be used for focusing on the certain region, where we have our own device that can be used for hard to access region. You can see the images on the display itself, so you do not have to really worry about the images. The quality of image is really good. We are using an autofocus camera, we have a bright field, we have a fluorescence imaging, and all these things we can do with very easy things. Whatever you have worked on is simple things like developing the system with a CAD model and fabricating it using 3D printing or injection molding. We are using a Raspberry Pi, which you are already using it. We are using a boost converter, which you have learned. We are using a charging module, which is available. We are using a lithium ion battery, which is available, right. So it is not a great deal to develop a system when you know the real problem, right. That is the thing. It is very important that what is the problem and how can you develop a system for solving that particular problem, right. So with this I will end up my module here, and I will try to see some of the videos that if available I can show it to you, so that you know in detail how the Wellscope and Oral IDs are used in a real life situation, right. Till then, you take care. I will see you in the next class. Bye.
Alright, Michelle. So now we're just going to look around the vestibule area and check for any lesions, any dark areas. Okay. Okay. I'm going to check around the cheeks. And take the tip of your tongue and place the roof of your mouth. I'm definitely going to check under the tongue. This is usually where oral cancer occurs. Okay, good deal. And just stick your tongue out for me. Just going to grab with a 2x2. and look on the sides of the tongue. The lateral borders and under the tongue are the common places for oral cancers to occur. Okay, I'm just going to look in the back of the throat, the back of the tongue. Say all for me. Okay. All right. Everything looks clear. No dark areas.